The last time we had this briefing was on Monday, and this is the second one for the week. Now I'll be calling on the chairman of the Presidential Task Force to deliver his remarks, after which we'll take the updates from the Minister of Health, the DG and CDC, and the National Coordinator before we take your questions. I now invite the chairman of the Presidential Task Force on COVID-19 to the podium to deliver his remarks. Dear Chief.
Hello, how are you today? All right. Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, let me welcome you from a very long break. I hope you had a wonderful weekend of celebration, and to thank you for your patience. Today, the 11th June 2020, national briefing. Nigeria witnessed a spike in number of confirmed cases when the number recorded jumped to 663 on Tuesday, 9 June 2020. This number gives us cause for concern as a task force and as a nation. In the Presidential Task Force briefing on Monday, 8th June 2020, I emphasized that a great majority of Nigerians are still susceptible to COVID-19 and cautioned that if we allow it to transmit easily between us, it may be even more deadly. That admonition remains very valid, and we still underscore vigilance and self-preservation. The Presidential Task Force continues to monitor the level of activities and compliance with the guidelines nationwide. Consultations will continue, and tonight I will be holding another round of video conference its appeal to governments at the subnational level as well as our security agencies to enforce the guidelines and protocols firmly. The Presidential Task Force would also be meeting with the heads of these agencies to further fine-tune strategies to ensure compliance. This afternoon, the Presidential Task Force met with the House of Representatives Ad Hoc Committee on COVID-19. The interaction was robust, and we received assurances that the legislative support required will be given to help us overcome this pandemic. Similarly, we are pleased to inform you that His Excellency, Mr. President, held a video conference meeting with the President of the ECOWAS in his capacity as the ECOWAS champion for the control of COVID-19. During the conference, matters pertaining to regional response to the pandemic were discussed. Specifically, such matters include our common risk as a sub-region, the need for our collaboration in response, our interdependence, and Nigeria's role given our large population and the position of Mr. President as ECOWAS champion. Tomorrow, Nigeria will be celebrating Democracy Day. The Presidential Task Force urges that we should celebrate in solemn and reflective manner. We must ensure that our goal is to stay alive and remain COVID-19 free. Let the date be a reminder of the realities of our times, the disruptive effects of COVID-19, the realization that we are faced with a new normal, and the necessity for us to individually and collectively prepare ourselves to conquer this pandemic. The best celebration we would bequeath ourselves is to strengthen our individual and collective resolve to abide by the guidelines to protect ourselves, our friends, our loved ones, and the country at large. The Presidential Task Force has advanced in its preparation for taking precision measures within the high-burden local government areas identified in our previous briefing. The strategy will be unfolded in due course. We are also emphasizing risk communication and community engagement in a sustainable manner. We therefore urge state governments to reach out to traditional, religious, and community leaders for dialogue and education. The major message will be ownership, behavioral change, and taking responsibility. I now call on the Honorable Minister of Health and subsequently the DG, Nigerian Center for Disease Control, and the National Coordinator, who would update you before we take questions. I thank you for listening.
The Secretary to the Government of the Federation and Chairman of PTF, Honorable Ministers, Director General, Permanent Secretaries, Directors, ladies and gentlemen. We all are constantly reviewing COVID-19 activities and developments at home and abroad to learn as much as we can about this novel coronavirus disease. We have learned a lot, and among what we have learned, for example, is that patients are most infectious during that asymptomatic period after they are diagnosed and spread the virus even when they do not look or feel sick, or even if their symptoms will appear later, they are already spreading the virus. We also learned that patients who have no symptoms at all, or who have no symptoms but have been sick, may no longer be infectious after 14 days, even if their PCR tests identify RNA evidence of the virus in their system. These are, of course, those who are diagnosed positive and they are asymptomatic. Those with symptoms will continue to receive treatment for the number of days that they are clinically unstable. Global evidence shows that up to 45% of infected persons may have no symptoms at all. In Nigeria, the proportion of confirmed cases that is symptomatic compared to asymptomatic is about 40 to 60, respectively, which means that if 10 persons are able to infect you with COVID-19, 4 of them will look very well, indeed. Another 3 or 4 of them will have mild symptoms that can be trivialized, even by healthcare workers who have experience, and that is perhaps a possible reason for initial relatively high rate of infection among workers. Therefore, the cheapest and easiest way to protect oneself is with a mask. In this case, a cloth mask, not necessarily a medical mask, but we must also make clear that that alone does not do the trick. You must still maintain other measures that are advised: distancing, hand washing, and respiratory hygiene. And this is why the Federal Ministry of Health constantly urges citizens to adhere strictly to all these guidelines, wearing masks when outside your home, and also to all the other non-pharmaceutical measures, especially since the confirmed COVID-19 cases in our country is continuing to rise very slowly, which also gradually increases the number of persons in society who may be positive. If they have symptoms, they'll be in hospital, or they have no symptoms, they're in the community. Yesterday, we had 409 new COVID-19 confirmed cases, which increased the total tally to 13,873. We have successfully treated and discharged 4,351 persons, and unfortunately lost 382 Nigerians to this disease. Although these numbers are only creeping up compared to other countries, and the case fatality rate hovers around 3%, we are concerned and at high alert. We have no room for complacency or overconfidence, and we need to be ready for any sudden shift in fortune. The Federal Ministry of Health, through the NCDC, is activating additional laboratories in Akwa Ibom, Jigawa, and Oyo states, which brings the total number of laboratories in the network to 33. More are being prepared as we work towards a target of at least one molecular laboratory per state. Optimization of some laboratories is also going on. We are planning for targeted community sensitization activities, especially in 20 high-burden local government areas, with sensitization workshops on infection prevention and control for healthcare workers, both in public and private hospitals, particularly here in the FCT. The Federal Ministry of Labor and Employment, the Federal Ministry of Health, and the House of Representatives, led by the Honorable Speaker, have been engaging the National Association of Resident Doctors to address issues raised by young doctors. We have had dialogues with them and with other government agencies and ministries, and also with health-related associations. The dialogue addressed issues on welfare allowances for healthcare, for frontline healthcare workers, and redressed issues on personal protective equipment, which have been supplied to all states and to federal teaching institutions for the safety of our healthcare workers. These engagements have been productive, and I'm confident that our resident doctors shall show understanding and reciprocate the efforts that have been made to address these grievances. The issue about just resident doctors has been resolved by the board, and the remaining are being, as much as I know, I think already in the process or in the pipeline. I wish to thank the Honorable Speaker, Right Honorable Femi Gbajabiamila, and the Minister of Labor, Dr. Chris Ngige, for their commitment in ensuring industrial harmony in the health sector. I would like to use this opportunity to also inform stakeholders and the general public that the much-awaited reforms for operationalizing the Basic Healthcare Provision Fund is about ready after a period of time in which we had to carry out certain corrections which were pointed out by lawmakers. This will be revealed after presentation to stakeholders in the shortest possible time. However, I can see that all errors in the manual have been addressed and corrected, and the new document vastly improves on the earlier one with regard to service delivery package and other features. Finally, I wish to urge everyone to be your brother's keeper, to always wear your mask in the public, observe hand and respiratory hygiene, and do not go out of your house unless it is absolutely necessary. This advisory is particularly important for vulnerable persons and persons over the age of 60 that they should stay in their homes unless there is something absolutely necessary that they have to attend to personally. Thank you for your attention.
Chair of the Presidential Task Force on COVID-19, honorable ministers, gentlemen of the press, good evening. Today we'll talk about two important topics. One is on the increase in numbers that you've all seen happen as we report new cases every evening. As we have eased the restrictions that we instituted across the country, and our states eased those restrictions, we have expected the numbers to increase. And we have announced this severally to expect an increase in numbers. So this increase in numbers is not unusual. There are always a few weeks lag. And as we increase testing and ease the lockdown, this is a virus that goes from one individual to the other. Therefore, it is most likely that we will see an increase in numbers. Whether that increase continues or not depends on our collective action, like we've always said. And sometimes these numbers are necessary to remind us of that reality. While the numbers of death as a proportion might appear small, these are all people that many of us have gotten to know, and every day you get to hear about one other friend or relative that unfortunately has passed away. So these numbers are important. We see a lot of suspicion around the numbers. We sometimes wonder, the people saying that, are they not watching what is happening across the world? Are we all collectively with India, Brazil, the US, the UK, is there some form of global collaboration to deceive Nigerians? It's not the case. This is the reality of what we face, and we have to come together to address this. Continue to address it as we have been. The other topic that has been receiving global attention is something called contact tracing. This is an activity carried out by public health workers at the state level in every state in Nigeria, but really carried out across the world. It's one of the key strategies in the control of any infectious disease. Now, when the chains of transmission are easier to define, such as an Ebola outbreak, where everybody that gets the infection ultimately becomes ill, that activity is a lot more defined, narrow, and specific. In a disease like COVID-19, where 80% of the people are asymptomatic, sometimes it's difficult to say exactly from whom or at what time you got this virus. And this is a very difficult process if contact tracing has been carried out on you, because you then wonder, where did you get it? Who did you touch? Where did you touch? From who might you have gotten this virus? It's also difficult for the people doing this. For 4 months now, people leave their homes every morning, going out to do contact tracing, with no end in sight, with new numbers increasing every day. So really the task for the public health workforce, they have their task really cut out for them as they do this. Across the world, there are consultations on how we can do this better. Can apps help? Can technology help? Can social sciences help? Can our ability to interact with people better, our ability to speak the language that people speak, to communicate with them more effectively, to ask them questions? How do I deal with the stigmatization of when public health workers come to your house and ask you questions on who you might have been in touch with? How do we deal with that? And states have been doing this differently. Some states now use completely unmarked vehicles so that people don't feel stigmatized when public health workers come to them. So there are no easy solutions. What we've been doing with states is to come up with key performance indicators for all contacts being traced, following up how many contacts are traced for every new case. We have already seen that the states with the most number of cases, Lagos, FCT, and Kano, are struggling the most to follow all the contacts, because the more cases you have, the larger the number of contacts you have to follow every day. So right now, the case to contact ratio is smallest in the states with a lot of cases, and they're really struggling to keep up. And this is really to encourage them across the country to keep pushing in this direction. One important group of stakeholders to help us reduce the stigma are religious and cultural leaders, traditional leaders across the country. This week, Dr. Liu and I had the privilege of meeting the traditional leaders of the FCT. They all came in their mass, ready to take on the responsibility of communicating to their people the challenges that we are facing and how we will collectively respond to this. This is really what we're encouraging every state across the country to bring in a diverse set of voices to preach, to confirm to people the challenges that we face, that these are real, nobody is making them up, there are people behind those numbers, and we need to come together to do what we have to do to reduce transmission. So on that note, over the next few weeks, we will be working very hard to improve contact tracing across the country, both with technology, with sociology, using the leaders, all the leaders that we have in our society. And on that note, I wish you a happy Democracy Day tomorrow. Let's work hard to protect the democracy we fought so hard to get. Thank you very much.
Chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. Today I would like to first of all talk about the issue of behavioral change. As we know, the eased lockdown that we've just gone into was done partly for the purpose of gradually reopening our economy. And it is also evident, though, that in other countries, just like in Nigeria, that easing the lockdown could result in a significant increase in the number of COVID-19 infections, and indeed we are seeing that. Thanks to the collective effort of our partners, the private sector, donor organizations, and concerned citizens, we continue to do a lot of sensitization work around this. And the recent findings from the NOI National Poll has shown that about 98% of Nigerians are aware of COVID-19. 55% of Nigerians have received messages on COVID-19 from government sources. 51% believe that they can differentiate fake news from official news items as it relates to COVID-19. 90% of respondents trust the messages received regarding COVID-19 from genuine sources. 98% have received messages on preventive measures, and the same proportion have received messages on what to do if they develop symptoms. 93% of respondents intend to adhere to the message, but intention is not the same as action, as we can see. We know that the data shows that knowledge is not being translated to a change in behavior. Clearly, it is one thing for us to be aware, but it is another thing to actually act on our knowledge. And this is what we are finding within the response. So we are appealing to the public to please change our behavior in order to save lives. This is clearly a call to action to translate knowledge to life-saving action and infection prevention. It is very clear that the public in general are not adhering strictly to the preventive measures against this virus, and this is shown clearly in our behavior, despite the fact that we do have the knowledge to protect ourselves. But of course, sometimes it is human nature now to stick to what we are used to. But in our view, we do not have the luxury of ignoring these risks. Therefore, if we are going to work, if we're going to the market, the farm, the church, or the mosque, we must remember to translate the knowledge we have of wearing masks, of washing our hands, of physical distancing, and other advisories to action. The PTF, together with other partners, have circulated health protocols and guidelines widely. These have been shared across digital space, the social media, the print media, and also at the grassroots through thousands of community volunteers, mobilizers, and influencers. As the world continues to look for a permanent solution to the epidemic, we must not give the virus the opportunity to win this war. We must not make it easy for the virus to spread. I would also like to briefly, I know the DG and CDC has talked about stigma, but I just want to briefly re-echo our concern with the ongoing issues of stigma against people who have COVID-19 or have even recovered from COVID-19. There's no doubt that stigma and discrimination makes our job very difficult when it comes to identifying persons with COVID. There's also no doubt, based on the science, that if you recover from COVID, you are not a risk to anybody in the community. We have to change the way we relate to people who have COVID or those who have recovered from it. I am very certain that none of those who have had COVID intentionally went out to seek COVID-19. And therefore, to a large extent, it is not within our power to resist it unless we take those actions that are necessary within the guidelines to protect ourselves. There are over 6.8 million COVID-19 cases worldwide, and we already have more than 13,000 cases or so in Nigeria. Therefore, for those that are saying that COVID is not real, for those that are saying that COVID is fake, I would say that 6.8 million people worldwide cannot be wrong. It is also insensitive to the memory of those who died. COVID is very much around, it's very much with us, the risk has not gone away, and we are appealing to the public to continue to take those preventive measures to make sure that they are safe. Thank you.
Thank you very much. We've taken the updates. We will now move to the question session.
Mr. Chairman, members of the PTF, my colleagues, good afternoon. My name is Nancy Oyedia Orom from AIT. I want to start with you, Mr. Chairman. I remember on this platform you have appealed to private and public hospitals not to reject patients of whatsoever ailment. Now let me paint this scenario. I got a call from a medical practitioner who told me that he referred a patient from his private hospital to the national hospital here in Abuja. The national hospital looked at the patient and said, well, your condition is COVID-19 related. We cannot accept you. This patient went back to the private hospital. The private hospital had to take him back in their ambulance to the national hospital. Well, after the back and forth, this guy was rejected and he went back home. Eventually, the next day, this guy died. Another scenario, sir, a woman had stroke in Lagos State. 7 hospitals rejected her, including the Lagos State University Teaching Hospital. This woman was depressed. Eventually, she died. The third case, sir, permit me to say this one. A pregnant woman that was discharged from a hospital went back 3 days after she was discharged. She had complications. She went back to the hospital where she was discharged. The hospital rejected her just 3 days after. Now, this brings me to my question, sir. Are there punitive measures for both private, public hospitals who are rejecting patients and who eventually die in this process? Are there punitive measures for these hospitals? And secondly, the second leg to that question is there a channel where some of these members of the public can explore, maybe to report some of these cases to the PTF or the federal government? So I don't know, you would like to react to that. Sir, okay. So my second question was supposed to be for the Minister of Interior, but he's not here. Maybe you will take that question up. Okay, before COVID-19, sir, there was a training for newly recruits for staff who will be working at the correctional centers. There was a training that was ongoing in Lagos before the COVID-19 started. So because of COVID, they were told to go back to their destination. Now, these guys have received messages to return back to camp for the completion of that training at this time when Lagos is the hub of the virus. What assurance are we giving these people of their health? And finally, to the DG NCDC, well, I must commend you because I had a colleague who is in one of your isolation centers here in Abuja, and the place is top-notch because I had to do a video call with her. But it brings me to my question. Post-COVID-19, what happens to these isolation centers? Are they going to become full-fledged hospitals? I don't know. Thank you.
Good afternoon all. Rachel Abuja from the News Agency of Nigeria. My first question is to the Minister of Health. Sir, you just made mention of the Basic Healthcare Provision Fund. I would like to know what's the error we are looking at in this operational manual, because it's taking so long, and we now have another committee on this same manual. What's really the problem? We're actually fighting an unseen war, and we really need the basic healthcare provision that it is. My last question, sir, beyond the training of trainers that was done to scale up or let's say support the primary healthcare centers across Nigeria, I would like to know how equipped these primary healthcare centers are as at today to support the response against community spread. My last question is to the DG NCDC. Sir, where is the country today in achieving targets set on the national testing strategy? And what's our new daily testing capacity as at today? Since we now have 33 labs in our network. And how many tests can we do per day at the moment? My last question is to the coordinator, PTDF. What measures are we truly looking at to encourage states, most especially the 20 hotspot local government areas, on effective contact tracing and sample collection? And I would like to know how many patients at the moment we are treating them for that are being treated at home for COVID-19. Thank you very much. Because of the numbers in Lagos, it's not matching.
Good afternoon, sirs. My name is Hassan Umar Farouk. I report for Liberty Radio and Television. My question is to the AGM, sir. In your speech, you emphasize on taking responsibility and ownership of this fight against coronavirus, sir. Isn't the lockdown means transparency such responsibility, which is very enormous to Nigerians, sir? That boils down to the issue of trust. I want to know, sir, what gives you the confidence to relinquish this fight to Nigerians? Thank you very much.
The chairman of the task force, members of the PTF, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question actually goes to the Minister of Health. Sir, medical experts, especially in Lagos, they are claiming that there is a new strain of COVID-19 in the country that kills faster than the initial strain that we had in the country. I'm sure you must have seen the stories flying around, so we need to get your reaction on that story. Then my next question, I wish the Minister of Aviation was here, but I can direct it to the National Coordinator. I want to know, are we on course, in terms of the plans for opening up the airspace? And in the coming days, are we likely to see an easing on the restriction of interstate movement and even the curfew? I ask this because, 21st of June is just around the corner, so I want to know where we are in terms of that plan. And the final question actually goes to the chairman of the PTF. This is more of a concern, and a group of people need your intervention. Well, in spite of the federal government's directive through the Nigerian Shippers Council to all shipping lines and terminal operators that imported goods and containers that arrived during the lockdown should not be charged demurrage fees. COSCO Shipping Agency and CFAC terminal operator have refused to comply. They are insisting that demurrage be paid before the cargoes are cleared and delivery taken. So, sir, they want to get your reaction to this, and also if you can intervene, because you had also told us here that during the lockdown, those demurrage charges should be dropped. Thank you.
Good evening, all. My name is Friday. Okay, I'm a reporter with Channels TV. I'd like to direct my first question to the DG and CDC. There is this new test kit, RNA Swift test kit, that was developed by a Nigerian, Obinna Nwokoji. We heard a report that you've approved it, and as part of the test kits that you are using, we'd like to get a confirmation from you whether this is true or it's another false story that's making the round. Then the second question, I would like the PTF chairman to respond to it. It has to do with sporting activities. We eased the lockdown or the restrictions on places of worship. Even markets are now back. We know that at the beginning of this pandemic, the spread of it, to prevent the spread of it in Nigeria, sporting activities were suspended. One of them was the Nigerian Premier League. Is it time for them to also resume, or the PTF is thinking about another time to resume sporting activities in the country? Then I also like the Minister of Health to give us update on the Madagascar HEBA solution. The agencies that have received the samples for further studies, like the NAFDAC, what update do we have from them? Because this, by my calculation, this is the third week already. The Minister of Education, please. Last 2 weeks, I asked the question about schools that are not running on our curriculum. These schools are doing online courses for their students. The question now is, can they also conduct online exam for the third term for their students, just for them to catch up with their counterparts, since they are not going to be physically present in classrooms? Can they go ahead and do that? And I think that is about the last one. Yeah, thank you so much.
Good evening, sirs. My name is Juliana Taiwo Baloyin. I write for the Sun newspapers. The coordinator, sir, you've last time you did assure us that the media, those on essential duty, will not face any harassment from the security operatives. But last night, some of our colleagues had a raw deal with them at the border between FCT and Nasarawa. So I want to find out what are you going to do to resolve this once and for all with this as security operatives? The SGF, sir, I don't know. We understand that NIPIPs are again planning to go on strike over the implementation, a reduction of workforce and all that. So they are protesting. It has to do with COVID, because they are wondering how this is affecting them as well. So the coordinators are in the past 48 hours. I think the SGF can also answer this. in the past 48 hours, Nigeria has recorded over 1,000 cases. With this upsurge in numbers of cases, I mean, is the PTF considering advising the president on a total lockdown again? Thank you.
Good afternoon, good evening, Chairman and members of the PTF and my colleagues. My name is Mitaire Ikpen of the NTA. My first question is to the DG of the NCDC. Sir, if you say that about 80% of cases are asymptomatic, and with your new discharge protocols recently for asymptomatic patients, which is 10 days after onset of symptoms, one would expect that by now more than half of our cases would have been discharged. Why is this not the case? For the Minister of Health, the cold season usually comes with a lot of respiratory infections like pneumonia and others. Is it possible for health workers at this time to mistake some of these infections for COVID-19? And for the PTF chairman, the NCDC DG says that easing of the lockdown is expected to instigate a rise in COVID-19 cases. And I'm asking that, should the pandemic spiral out of control, will there be another lockdown soon? Thank you.
Good afternoon, Chairman, Nigerians and colleagues. My name is Abbas Adebawale Jima from Daily Trust. May I seek the indulgence of the Chairman to pass a comment from a retired military officer in Nigeria? He mentioned some 3 names, but I'm very sure he will not mind if I pass his message to the entire committee. That was a message of commendation. And he said that he was commending you because he was aware of the consequence of this virus in other countries who have sophisticated health care, and they were recording thousands of cases. He also now said that the second reason why he was commending you was for you to add more to your, he used a particular word which is not my phone now, to your dedication. As you are not doing it for yourself, you are doing it for this generation and generation on board. I've passed this message. Thank you, sir. Now, my first question is to the Minister of Health. When the chairman said that the physical and mental health has been added to the treatment of the COVID-19 patients, the physiotherapist and the physicist were also being contacted, and because they will claim they don't have some backings like their colleagues. So what is going to happen to the cardiovascular specialist and the physiotherapist, like the mental health were taken care of? Then also was that Nigerians were complaining that they abided by the provision and guideline of this committee and by extension the federal government for over 2 months, only for them to come out during the ease of the lockdown, and the DRTS, also known as the VIO, coming to charge them for expired papers, expired driving license, and they no wonder, well, where would they have gotten the money when they were being at home for 2 months during those times when the papers had expired? Some of these vehicles were already being impounded, and we are in a crisis situation. So they want action, they want some commitment now that everybody can watch at home and add a case. Now, some of the states were also expressing reservation that they might not be able to cope if the federal government completely hands up the issue of management of COVID-19. And they were now asking the NCDC DG, what measures would they put in place to reassure Nigerians, especially with the comment of the Nigerian Medical Association? Even when the federal government is there, the cases kept rising. If you now hand it over to the state, what is going to happen to them? Thank you.
Thank you. We have taken all the questions. They are directed at the Honorable Minister of Health, the DG NCDC, the National Coordinator. And there's a question for the Minister of Aviation, which I think the National Coordinator can accommodate, the Honorable Minister of State Education, and the Chairman, PTF. So we'll take the Honorable Minister of Health at this point, then the DG NCDC, then the National Coordinator, then the Minister of State Education before we take the SGF, in that order. Honorable Minister of Health.
So, good afternoon again. What is going to happen is that there are certain questions that should be, actually, they direct it to someone other than who really is doing that question. So the question of rejecting patients, for example, is a hospital services issue. So it is unethical to reject patients who come to a hospital for treatment. I have said here repeatedly that every person who comes to a hospital must be seen and attended to, and at the least given advice. You give him advice on what to do. If you can't handle it, advise them where to go or call transport for them. But to just say, go, we don't handle that is unethical, is not acceptable. So if that happens anywhere, you have the authority to write to the board, the governing board of that hospital and lay your complaint. Or you can also write to the Ministry of Health. Or you can write to the State Ministry of Health if it's a state-owned hospital. If it's a private hospital, you can write to the medical director, or if they have a government board, you can write there to express yourself. This is very important because self-correction begins with being with it being pointed out that something was not properly done. So we do receive cases of complaints like that, and we always follow them up. And in cases where it is proven that it is not, there's an infringement on the duties of a doctor, it is referred to the Medical and Dental Council of Nigeria, and it is well known that they have gone as far as withdrawing licenses of doctors for cases of really serious misbehavior, unethical behavior. So what becomes of isolation centers? Yes, that's a very good question, because isolation centers will not always be needed. They will always be needed when there are problems of public health that require isolation. So that's one of the reasons why we are advocating that isolation centers should be within the premises of a tertiary hospital. Let's say within the premise of a university teaching hospital, or within the premise of Federal Medical Center, or at the least a premise of a specialty hospital, depending on what how much space there is. The reasons, there are two reasons. First, if someone is in isolation and they develop any kind of complication, you might require doctors from different specialties, not only one. So if you have an isolation center outside town, it will usually be one medical officer who is there, and if you have complications, you start looking for where to take the patient to, and that is not a good idea. So if it is within the premise of a tertiary, you can get the specialty that is able to handle it. Now, in the case where there is no isolation, well, it can be converted to other uses, disinfected and converted to other uses, and then immediately vacated. When this outbreak occurred, not all hospitals in the federal system had isolation center. We told them to evacuate a wing and make that wing ready. So they had to do that. Some of them had to do some real space engineering, workspace engineering to make that possible. But if you have a steadily built isolation center, then it can easily be evacuated and converted back to its use. Having said that, I also like to make an appeal that philanthropists and organizations who want to help with building isolation centers need to consult NCDC for the correct design An isolation center is just not any kind of house. It has to be designed properly, the spacing, the rooms for the beds, the nurses' bay, the consultation room. So NCDC has a correct design for that, and this is a design that must be used. And again, not to build it somewhere where it is not accessible, where the full benefit of it cannot be achieved. Now, Basic Healthcare Provision Fund, as you know, it was launched earlier by the Excellency the President, and it started operating. And within a few months, the Senate Committee on Health invited the Minister of Health and drew our attention to certain areas which they told us were not in consonance with the Act, and that we needed to correct those ones, and until they are corrected, we should momently halt. So the correction took a bit longer, actually longer than was actually expected. But the benefit of it is that something much nicer with a bigger package has emerged. Those errors have been corrected, and we are going to be discussing with the stakeholders now to see about representing it to the public very soon. But those errors have been corrected, which we were told offended certain sections of the Act, so that we have something stronger and more robust. Now, the primary healthcare centers, whether they're well equipped, well, the primary healthcare center is perhaps the most important of the infrastructures for addressing basic health care. And as you know, the policy of the government is to have at least one functional primary health care system center in every political ward, which will give us over 9,000, nearly 10,000. Right now, we have about 40 or 45% of them ready. But what has also happened in the last few months is that we have made a completely new design of what the primary health care center should look like. I think we'll take the photograph of it and send to you for publication, a new design, so that even existing primary healthcare centers will have to be redesigned that way. And we hope we're looking to contact our development partners and agencies, probably from budgetary sources, to redo and complete the primary healthcare centers, and then the staff for them to be operational. But there's a very comprehensive new approach that gives the assurance that the primary healthcare center can work around the clock, must be able to deliver service even at night, so that it doesn't open and close like an office. And citizens can go there when they need help and not be stranded because the primary health care is closed for the day. As for the the strain of COVID-19, yes, when Nigerians were coming back in batches from different countries, from the United States, from I think from Saudi Arabia, from various countries in Europe, from China, the question did arise, and some of them were tested positive for COVID-19. The question did arise whether the strain of COVID-19 they have is the same as the one that was known. As you know, the Nigerian Institute for Medical Research did genomic sequencing, was the first in Africa to do that, of the virus, of the index case that came long ago. And it was confirmed to be the same strain as what was circulating in Italy and circulating in China. So we raised the question whether there has been a mutation since then in people coming from other areas. I don't have any information on that yet, but it is suspected that it's possible. I'm not yet updated, but I'm sure that research centers, particularly the one in Lagos, Yaba Medical Research, and the one in Ede, are trying to do a sequencing that will show us whether all these viruses are the same or whether they are different sequencing. As for the Madagascar herps, we do not have any information as yet. I have already announced that we give them to our research centers. They are working on them. None of them has reported back yet. Now, the time it takes for all this research is not what we know, but I think when a period has elapsed, I will call them and find out what they have found so far, if they can give me an interim report. Then the question of the cold season, and well, it is true that period during Harmattan, you get an increase in upper respiratory tract infection. in Qatar, cough, and so on. So it may be a challenge to start differentiating between that and COVID, but it's good to go to get the history and to advise the patient put on a mask or give them a mask so that whether it is COVID or ordinary influenza virus or any kind of virus, there is protection of others. And then carry out the normal diagnosis. Usually the runny nose is a common feature of that common cold infection, and a very heavy productive cough is part of it. The COVID-19 is generally, but not always, generally a dry cough. So clinicians will have to try and find the difference between the two, but the symptoms can be a little similar. The issue of mental health, yes, you got it right that we are taking that seriously. The Ministry of Health did do mental health support in the Northeast. In fact, we are still doing it. The Northeast to set up a program for psychosocial support of victims in the Northeast. I personally had declared it open in Borno a couple of years ago. So we have experience in providing psychosocial support, and there's a plan going on here now to build a protocol for giving psychosocial support to those who are going to be suffering from the after effects or even the effects of COVID-19 infection. I think that's all. The management of COVID cases, yes. The management of COVID cases is supported by the federal government, by the federal ministry. We support the states. You have already heard that NCDC provides them with PPEs and provides them with equipment, set up a laboratory, and the laboratory is functional for diagnostic capacity. But there's a plan to build up isolation centers. But before those are ready, there are other things that can be done only within the state, like providing accommodation for persons who have no symptoms or little symptoms. In the maybe in hotels, we have requested that hotels can be rented or the dormitories can be used. But many hospitals have done many states have done very well in that. Some have cleared particular general hospitals and converted them. FCT, for example, has converted the EU training center into a complete new treatment center for COVID. There are donations from the private sector, like the Dome here in Abuja also. And the hospitals that they converted, I think Karo Hospital also to the same purpose. And I recently declared open such a hospital in Edo State, where the governor cleared one hospital and just prepared it for COVID. So there are many states who are taking that example, and the federal government supports them with various needs that are identified. So it's a two-way game where the states actually are taking the lead. If they are short of doctors, they also call up for support in that. And in case they require intensive care doctors, we are participating in trying to train intensive care doctors if and when the need arises for the states.
So, thank you very much. Just a few questions. Rachel, on progress towards our testing strategy. We're pushing hard on that strategy. We're between about 2,000 tests per day, thereabouts, sometimes a little bit less. Over the last 2 days, we've activated a new lab in Oyo by the University of Ibadan, the University College Ibadan, the University College, which is part of the University of Ibadan, actually affiliated with the University Teaching Hospital. So a lot of work going on. Although the Lassa Fever Lab is just being converted to COVID right now, Jigawa, like I said, Ekiti. So there's a lot of work going on. However, if you had the SITREP today, you'd have seen the release of the monthly testing numbers. It should have been released yesterday, but there was a delay. So we really need the press, gentlemen of the press, to really use these numbers to advocate to the state governments. You know, that's really where the testing, the collection of samples happens. Right now we have, our labs are working at 10 to 20% of capacity, right? So we have the capacity to test a lot more. We can test about 10,000 samples per day, probably more if we were pushed hard. So the labs are there, the samples are not coming as sufficiently as we want. So we really ask over this weekend every state to push harder. We've been pushing with the state epidemiologists and the only way we can know whether we're on top of this is really by testing. And we are ready to do that. Gene expert labs locations will start functioning on the 14th of June. We've been working very hard over the past 2 weeks to distribute the cartridges to the first 7 centers, to train them, to make sure they're ready. So on the 14th of June, they start testing. So a lot of work has gone on to build the capacity of our labs, and that will continue until every state is able to test in their state. So the challenge now is we are challenging the states, leading the contact tracing, leading the case identification, to bring in the samples so that we can collectively know how close we are to the peak. Friday, I think your question, I just made a note of it. I'm going to look at that particular PCR test. There are lots of PCR reagents that we're bringing into the system now, so I'll get an answer back to you. Mitari, I think on the new discharge protocol, yes, there's a big challenge around some of the historic cases that some of them were never found, right? Some of them were, we've talked about this severally. We have a positive test. We try your phone number. We can't reach you. We go and look for you. We can't find you. And so it's very hard to discharge you if you were never brought into care. So, but we will have to make a decision with the states after some time how much effort is reasonable in terms of looking for every individual case. So there are quite a number of historical cases that can't be discharged at the moment because they never actually entered the system, even though they were positive. But at some point, we have to define them as unfound, create a new category maybe, and move on with that. But it's a very good question. It shows that you're looking at our data and thinking very carefully. So thank you very much. The last question was about handing over the response to the states. When we say we are calling on the states to take more responsibility, it's not that we're abdicating on our own responsibility. Health remains on the concurrent list in the Federation. It means that we continue to have a responsibility. Between last weekend and today, we have carried out the biggest distribution of PPEs ever since the response started. Enough to take every state, every FMC, every teaching hospital for about a month. Just the distribution of it was a logistics miracle on its own. Packing it, getting it ready, counting, recounting, making sure it gets to the facility, doing the accountability, getting the results back. And I think the last batch is going out today because we wanted to get it out before the public holiday tomorrow. So we continue to support the states. Everything we're doing is to support the states. So we're not abdicating our responsibility towards the states. We just want them to take more responsibility. And to be honest, we are seeing that happen. Many of these labs I mentioned, Jigawa, Ekiti, are all efforts by the state governments to accelerate the efforts themselves. And so we'll continue working hand in hand with all our state governments to improve the response across the country. Thank you.
So I think the first question came from Rachel regarding what are the measures to encourage states on contact tracing, particularly as it relates to the 20 local government areas that are hotspots. Well, we continue to work very closely with the states. Just this morning, I had a phone call with the Kano State Emergency Operations Center lead, the incident manager, to discuss how things were going along in terms of the house-to-house testing that they are doing. We are also working with the rest of the states. We actually have a host of strategies that we are currently planning that we hope to launch beyond just contact tracing, increasing testing in these local governments, making sure that there are community isolation centers linked to them, making sure that there are treatment centers that are functional. We've already put a lot of resources into risk communication and community engagement. Just a a few days ago, we had a meeting with stakeholders organized by the Honorable Minister of the FCT, where we met all the religious leaders within the FCT and also the traditional rulers as well as the chairs of the area councils, because we are really pushing towards greater community engagement, and this is particularly more relevant to the areas that are hotspots. So we continue to do the work. In terms of your question about case management, you wanted to know the numbers. Case management is actually handled by the Federal Ministry of Health. So I will push that back to Health. I don't have the numbers, I'm afraid. It's handled by Health. The other issue regarding journalists facing a raw deal, harassment with security operatives, etc. Actually, just a few days ago, we had a meeting where the Commissioner of Police, FCT, was there. And again, I emphasized the need to ensure that those that are on essential duty are allowed free movement. We have said this over and over again. We will write to the IG of Police again to raise the issue. I believe journalists, particularly those here, will probably have passes. If you don't have passes, just reach out to us and we'll see how we can arrange for that. Because if you have a pass and you have an ID card, there's absolutely no reason why you should be stopped by police unless it's for another reason, but certainly not from the perspective of the curfew. Airspace. Well, what we said to the aviation authorities is you need to let us know from the 21st of June onwards if you are ready to start opening the skies. We didn't say 21st of June, skies open. We gave them a window of 3 weeks to prepare. And I believe they are still preparing. We didn't ask them for regular updates in terms of how things are going. We expect them to come back to us. As you know, the aviation industry is highly regulated. There are certain things that they have to do before they start flying, such as retraining of pilots, recalibrating the aircrafts, and ensuring safety across the board, as well as the measures we need to impose at the airports to make sure that people are safe. So no, we don't have an update for that. We expect them to come back to us by the 21st of June. And if they come back to us and say they're ready from the 21st of June onwards, we will open the skies for domestic travel. And that's when we will address the issue of interstate restrictions and curfews. But for the moment, there's no plan right now to say 21st of June, here we go. So it's aspirational, if anything. The last one has to do with, is the PTF considering a total lockdown, considering the number of cases we've been having over the last few days? So as DG and CDC said, the number of cases we have is a reflection of the number of tests we do. For those of you who look at the NCDC numbers very carefully, if you look at the positivity rate, it still remains about 10 to 15% of the tests that we do that come up positive. So if you do more tests, you're going to find more. When we say there are 13,000 Nigerians with COVID, that's a minimum. It doesn't mean that there are only 13,000 Nigerians with COVID. No, it means those were the ones that we have been able to diagnose as positive. Even with the situation we are in, we are monitoring very carefully. Nothing is off the table. We still have options available. We will continue to work very closely with the community because we've now gone into a community transmission phase. We know that the only thing that will stop this pandemic, is behavior change. Because there's no vaccine, there's no preventive therapy. And therefore we have to continue to work right down at the community level to engage people and ensure that people have an understanding of the risks of their behavior and they are complying with the guidelines. We will continue to monitor this very carefully, but it's also a reflection of the number of tests we do. We are not surprised that the numbers have gone up because the number of tests we are doing has significantly gone up. A few days ago, we almost reached 4,000 tests per day. We had about 3,900 tests. And that's significant compared to our previous tests. So just watch this space and we'll continue to monitor and see how things go. Thank you.
Sorry, Mr. Coordinator, I ask you a question about Lagos State.
What's your question about Lagos State? Sorry? Okay.
Since we're using data and science to operate.
Okay.
Now, you see, Lagos have like 6,000 infected persons at the moment. Now, they have like, let's say, 944 patients present now. What I want to know is their bed capacity to admit persons. It's not matching up in the sense that it's more or less they now have people outside these facilities being managed. And my question is this: how many persons, let's say patients, are being managed presently in the country outside our security centers?
So I think NCDC, there's definitely data available on CITREP, but it's the availability of beds varies across states. We can provide you with that data. I know about 80% of those that are positive in the country are currently being managed outside isolation facilities. That's the sort of figure we have. But different states, some states have a lot of capacity in terms of beds. I know Kano, Lagos, they have run out of beds. A few of the other states are red. We actually have a line listing, an amber-colored listing of states that are in the red, where you have more positive cases than beds available. But we also have states that have very few cases and have a lot of isolation capacity. We cannot move patients around from one state to the other. So obviously, if you run out of cases, Lagos, for instance, they have almost 5-6 times the number of cases that Kano, which is the second state in terms of numbers, has. So of course, you're going to have a lot more people contributing to that proportion of 80%. Thank you. Okay, your question was about harassment by security agencies. As far as we know, journalists are allowed free movement because they are doing essential duties. Thank you.
Honourable Minister of State Education.
Good evening, everybody. Yes, the question as to schools that operate a foreign or run a foreign program in Nigeria and whether they can go ahead and test for their own term exams, truly they should and they can. Most of the schools who have that permit or who run such programs, basically only in Lagos and Abuja, are directed really towards embassies and people who have foreign nationals in Nigeria all of this while. So normally those schools, the American School, Regent, a few of the private schools that have that content, they are tailored really to satisfy the ability of some of the children of expats who live here, so that when they return to their countries, they'll be able to rejoin their own school system. That's why that's what their license included in the first place. I've heard stories that we have asked that they should not. What we said is what PTF has said. No movement, no return to classes. But we have not said people should stop learning. I'm encouraging everybody to try and learn. And if such schools are able to host online classes for the curriculum that they operate, and they choose to use the period to cover their syllabus, it is permitted from the exam body that they also ascribe to then conclude those schemes. It would not be proper for us to now say, wherever you are in your village or in your room or wherever your person is, you cannot issue him exams. It won't make any sense. Thank you very much.
Thank you. I'll now invite the chairman of the PTF, the SGF, to the podium.
I think most of the questions have been answered. The issue of rejection, I am glad the Honorable Minister of Health has made it quite explicit that it is unprofessional for somebody to refuse to attend to somebody that is in distress as a result of his medical condition. For that facility to turn them back, I think our advice did not say you turn them back. Don't manage them if you are not certified to do that, or you have not received accreditation to manage them. But in terms of the preliminary investigations, we never stopped that from being undertaken, and I'm glad that the Honorable Minister has dealt with that quite effectively, because some of the hospitals that were mentioned by AIT correspondent are government-owned institutions, and they are there to serve that particular purpose. And the National Hospital in Abuja has a whole wing. We visited it. It has a whole wing that is dedicated to COVID-19 with even an intensive care unit attached to the wing. Liberty, what gives me the confidence to ask Nigerians to take responsibility? I haven't seen the level of compliance. At this moment, I have no choice. We've gotten to the stage that every Nigerian must take responsibility. Because what we are trying to do is for everybody to take ownership of how he or she navigates this entire pandemic process to stay alive and to survive it. The best that government can do in this circumstance is to implement the guidelines, working with the subnational entities, with our community leaders, with our religious leaders, and all forms of informal leadership, so that the ownership is now transferred, because the business has moved from where it used to be to the communities. And unless, as individuals and collectively as a community, we take responsibility and we own the process, it will be difficult to navigate it. Watching the news on CNN these last 2 days was quite scary. The American health officials, either the Center for Disease Control or Director for Infectious Diseases, standing up front on television and telling the American people that the death toll will be about 200,000 by September. That's the fact, by the projections of what they see and the death rates on a daily basis. That is what has informed those conclusions. And basically what the officials are doing is that, yes, there's this much government can do, but two, the people have a responsibility. And they continue to drive home the point that even if beaches are open, other facilities, shopping malls are open, you have to take personal responsibility to ensure that when you step out of your house, there are certain things that you are expected to do, to wear your mask, to maintain social distancing, to keep your hands sanitized or washed, and avoid big gatherings. which are incubators for very easy infection. In that, the responsibility is not theirs of the official. The responsibility is for those that are stepping out of their houses to do these things that have been listed, to adhere by these guidelines. It's the same. It's the same. If the US, with every strength in its economy, in its health system, can be given a projection of 200,000 deaths, September is just down the line. We're talking about 3 months. And I'm worried if as a people and as a nation, we don't see this. So the truth about it is that there is this much government can do, but the responsibility has now been ceded to the Nigerian people. When you leave your house every day, you will be conscious of the fact that I have a responsibility to do whatever I am assigned to do outside my house and return home without an infection. Government cannot guarantee that. But you can work diligently to ensure that it does not happen. So that's my confidence, that Nigerians are resilient, Nigerians are very hopeful people. Even in the midst of the difficulties, we don't easily give up. We have this strong spirit of survival. And that is what I want Nigerians to hold on to and ensure that that strong spirit of survival takes them through these very difficult times where a small virus has disrupted their social and our communal life. Sporting activities, channels did ask whether sporting activities can resume. Well, like the Premier League and the rest, I'm not sure we are excited about opening up for sporting activities, knowing fully well that sporting activities in our country, particularly the game of soccer, attracts large crowd. If our guideline says that large gatherings are banned except, not to exceed 20 people except for places of work, I don't see the excitement that will be achieved if we allow sporting activities, particularly soccer like the Premier League, to resume in an empty stadium. A lot of the European countries where these games are big businesses have started looking at the prospects of returning to the pitches. But they are doing it in a deliberate and a very, very slow-paced manner. And most countries are saying that when they finally resume, it will be teams playing in empty stadia or stadium. We will get there too. But for now, we are concerned with the few activities that we have allowed to resume. And we've given ourselves 1 month within which to do a thorough assessment and see how we fare. That ties it to the question of whether, with the increase we are seeing, whether there will be a review of the ease of lockdown. The question is, we had indicated in my first address on this subject that we would study the situation, look at it, and see how we are going. And if there is need for review, that review will be advised by data, by science, by experiences of other jurisdictions, and by the peculiarities of our environment. To go back to a total lockdown must be taken in the context of what do we desire to achieve after we've locked down for about 5 weeks and seen how we fared. So the issue of review might not have that in contemplation, because you can't move forward and begin to move backwards again. In terms of strategic implementation of our policies, we might not be looking towards that direction, but we might be looking at how to strengthen what we have put in place, how to ensure compliance and all other non-pharmaceutical interventions that we have put in place. As to whether shipping companies still charge demurrage, I tried to get across to the Executive Secretary of the Shippers Council, who was coordinating that in the earlier stages of this response, to see if there has been a change of policy. I was unable to reach him, but I believe I will reach him over this weekend. And at the next session of briefing, I should be able to bring you up to date on what is the current policy. As the COVID-19 virus is changing in its characteristics and mutation, our policies are following behind, trying to change. I think the most important thing that we will take home today is that as we celebrate June 12th, our new Democracy Day, I want Nigerians to take to heart that this is really a challenging time. And like I said in my address, we must be sober and reflective as we celebrate the 12th of June as our new Democracy Day. You must have gotten the news alert. Mr. President will be addressing the nation tomorrow at 7 a.m. I believe he will bring words of comfort and words of encouragement to our people and expressions of gratitude to all of you that have stepped up in assisting the government to overtake and respond quite effectively to the COVID-19 pandemic. But what is expected of us as a people? I believe we have very, very critical role to play. And my appeal to all Nigerians is that we must do everything to ensure that we protect ourselves, protect our loved ones, protect our families, protect our community, and by extension, protect our nation. These are challenging times, these are difficult times. And it is only when we work collaboratively and in one accord that we will be able to overcome the difficulties that is confronting the entire world, not only Nigeria. This pandemic, like I keep saying, has exposed the weaknesses of our system. But the beauty about it is that as Nigerians, we are resolved, and that came out strongly in the interaction we had with the ad hoc committee of the House of Representatives, that we will not lose the gains of the experiences of managing COVID-19. And I believe that our health infrastructure and our social safety net system will come out much stronger by the time it is all said and done. So I wish you a happy Democracy Day and a very long weekend. We'll see you during the next briefing. Thank you.
During the lockdown, have been asked to pay demurrage. That is the issue, not for the new policies right now, the ones that came.
Well, they are all matters of policy. I don't know how that policy came about, and unless I speak to the operators of that policy, I won't be able to give you an accurate response, and that I'm going to do. For the goods that came in during the lockdown, what is the policy as regards payment of demurrage? That's what you want to know. We will find out for you and we will convey the appropriate answer. And if there are difficulties, we are all in this together. It is intended that we find resolutions to all the matters. Thank you. Yeah. They are being arrested because they are not complying with social distancing. Oh, with their vehicles. Look, the truth about it is because we are in these difficult times, you don't want to board a vehicle that its roadworthiness cannot be authenticated. We should not come under the disguise of COVID-19 and abdicate our responsibility. If I'm driving a commercial vehicle or even a personal vehicle, I must make sure that it is roadworthy. Sometimes we carry our families in these vehicles that have not been authenticated as being roadworthy. The tires are not good. The steering wheel is not working very well, and all that kind of a thing. I think the truth about it is that they should be allowed to do their job, to validate the roadworthiness of every vehicle, because not all of us have our own cars. We bought these commercial vehicles, and I would not want to expose you to any danger by boarding any commercial vehicle that does not meet the basic requirement of being roadworthy to be on the road. It can be even a greater risk in terms of causing accident. So please, we should urge all our people to ensure that they perfect their documents, their vehicles are roadworthy, then they can ply the road.
Thank you very much. With the wrap-up from the chairman, that brings us to the end of the national briefing for today. But before we go, a lot of reminders have come out of today's session. COVID-19 as a significant public health challenge facing our nation in modern times has woven its way into our social consciousness in very many ways. We should therefore give no room for complacency, for stigmatization, and for doubts about the potency of this virus, no matter the face of our relaxed lockdown. As we go about our daily living, therefore, let us remember that the simplest and cheapest way of protecting ourselves is to mask up and observe all the measures that have been put in place. But before we go, finally, let us recognize that we should mark the Democracy Day tomorrow in a reflective manner, in a very sober manner. We must resolve to change our behavior, take responsibility, collaborate with public health officials, translate knowledge to action by creating awareness. We wish you a very pleasant Democracy Day tomorrow. God bless Nigeria.